If the biggest thing stopping you from dental implants is the fear of pain, you're not alone. This is one of the most common concerns we hear because no one wants to trade one problem for another. I'm Dr. Jared Hall, prosthodontist at Nuvia Dental Implant Center. I'm going to walk you through exactly how pain is managed during dental implant surgery, what recovery actually feels like afterward, and what real patients say surprised them most. Because for many people, the pain they imagined was very different from the experience they actually had. Let's start with what surgery day really looks like. One of the biggest misconceptions about dental implants is that patients are awake and feeling the procedure. Here, that's not the case. During dental implant surgery, you're under the care of a licensed CRNA, and you're fully asleep for the procedure. You're not awake, you're not feeling anything, and you're not experiencing the surgery as it's happening. There's an entire medical team in the room whose sole focus is making sure the procedure is safe, comfortable, and done correctly from start to finish. For most patients, surgery day feels more like falling asleep and then waking up knowing the hardest part is already behind them. Now, here's the part that surprises most people. Unlike traditional implant approaches, you don't leave surgery here with a plastic temporary, a removable denture, or something fragile that you have to be careful with. Within the next 24 hours, patients return to receive their custom-made permanent zirconia teeth. These are not temporary teeth. They are not dentures. They are not something you will be replacing months later. Your permanent teeth are designed and crafted in our in-house lab specifically for you. That's what allows us to avoid the 6 to 10 month waiting period that is still common at many other implant centers. Where patients may notice some discomfort is not during surgery, but in the first few days afterward. This usually shows up as soreness or mild swelling as your body begins healing. Most patients manage this with prescribed medication or over-the-counter options, depending on their individual case. This kind of discomfort is normal and expected. It does not mean something went wrong. Swelling typically peaks around day 2 or 3 and then steadily improves. Many patients are surprised by how manageable this phase feels, especially knowing that they already have their permanent teeth. Pain is usually the first concern people have, but we know there's another big question right behind it: cost. That's why we put together a dental implant cost guide that explains what affects pricing and what options may be available, and how some patients are able to potentially save thousands on their brand new smile. If you want clarity around the financial side without pressure, you can find that guide link below. Now let's talk about what recovery looks like after that first week. After the first few days, most patients notice a significant improvement. By the end of the first week, swelling has usually gone down, soreness is minimal, and many people are back to their normal routines, including work and daily activities. Over the following months, the implants integrate with your bone. It's your body healing quietly in the background. In this stage, you can eat soft foods, anything you can cut with a plastic fork. And at month 4, we'll see you again to address any concerns and track your progress. So how painful are dental implants really? There can be some discomfort during recovery, but for most patients, it's far less than they expected, and it's temporary. What lasts is the ability to eat comfortably, smile confidently, and stop worrying about ongoing dental problems. If you're still unsure, that's completely okay. Education is the first step. If you'd like to hear a real review from a real Nuvia patient or dive more into the cost of permanent teeth in 24 hours, click the videos below.